Hi, Health Promotion and Prevention. Dr. Kim Paxton here. This is the second part of week number 3, and this topic has to do with growth and development across the lifespan. There's also a component that you're going to be working with called life course perspectives. And when you think of life course, think of it as the elements that come in to affect who you are in your life, and then how those transpire into affecting your health. The objectives this week are really simple in relationship to this second module. One, we're going to be looking at how does growth and development really occur, and how does it actually guide what we do in relationship to health promotion and prevention and that health education that goes along with that. The other thing that we're going to be doing is actually looking at how different theories of development like Piaget's or Kohlberg's interplay in, and how do they help us as nurse practitioners understand where this person is at, and how do we use them to help us develop that right educational component for this person. And then the final thing is working with the life course framework and actually looking at it to help work with health promotional strategies in a population. So there's readings this week. We have chapter 15 in Edelman, which is our growth and development chapter. And in this particular chapter, there's some really good information. Some of it you've had before, maybe in your assessment class, but pay specific attention going into pages 345 to about 348. Here's where it really talks about that growth and development research and theories. And as you're reading through these, really look at what they're saying, especially when it talks about the cognitive. Now remember, in the chapter that we're reading before this one, the health education chapter, they talk about the 3 domains that are associated with adult education. And one of those domains is the cognitive domain of education. Well, getting that understanding from a theoretical perspective of what really integrates into cognitive can really help you to hone your skills in the educational components that you develop for your patients. The second part of our readings has to do with picking at least one chapter of the several that are here and then reviewing that in relationship to what you're doing in this program. So if you're an adult AG nurse practicing student, you may want to look at that young adult, middle adult, or older adult. If you're an FNP student, you may want to be looking more at the adolescent or the child or the toddler. You choose whatever chapter you want and read that chapter. We need you to become familiar with what life course is. So we have a article for you here to read. It's a little bit complex, but the information in it really helps you understand what life course is talking about, and then how do we actually apply that information to help an individual for health promotion and prevention. For those individuals in the course that are involved with the FNP program, the life course also has an adolescent component to it that you might want to take a look at. So the activities this week, we actually have embedded a life course game for you. We have the instructions for you. We have all the information on how to play this. This is going to take a little bit of time. We're asking you to play with another individual. It could be a colleague, it could be a family member, it could be numerous friends. But what we're hoping for you to gain from this is gain an understanding and perspective that while we all may be 30 years old, we're not all at the same stage of impactness on our life and our health, because of the biopsychosocial components of our environments that are affecting us. And how do I then adjust a health promotional plan or health promotion education if this is occurring? The next thing we're going to have you do is there's a discussion going on. So we want you to look at that population and what might you do that could be protective or to reduce those risk factors that are influencing their health or possibly their development as a human. And then how can you apply the aspects that you gain from life course actually into your health promotional plan or how you look at an individual? This is the life course instructions, and over to the right I've provided you with a picture of what the actual life course game board actually looks like. So please take some time, review the instructions, play it with at least one member to gain an understanding of what we're trying to do with this particular assignment. It's really not hard. I think more time is going to be spent in understanding the instructions and how to play the game than actually playing the game and the learning. So please embrace it with an open mind, have some fun with it, and I look forward to hearing what you found in relationship to Life Course and how it actually affects life, health promotion, and a person in general.